let's talk a little bit about resistance bands and how to use them as corrective tools when it comes to squatting and split squats. The first is the classic mini band around the knees when you're squatting. A lot of times people will put it above the knee. You also have the option to put it below the knee, which makes it just a little more challenging because it's a little further away from the hips. But this is classic because if a person has valgus knee, or when the knees collapse inward, the band is trying to pull the knees in more, so it encourages the person to push the knees out. So this is a corrective means to encourage that individual to have a better knee alignment with the ankle. So that way our line of force goes through the legs and up into the hips a lot better, so we don't have that fallen knee and we get that inward stress, start to get negative stress on the hips, feet are in a bad position and all that stuff. So that's a classic. Now let's talk about the feet. Now this is one that you don't see as often, putting the band around the feet. Putting a band around feet is great. It encourages the same kind of thing, but we're now encouraging the foot to create an arch. Now, if we create an arch in the foot, it naturally puts the knees outward. So if the individual has weak hips, that's when we would want to put the band around the knees. However, if an individual expresses fallen foot or bad arches, this is when we can use the mini band to put it around the feet and encourage that arch to occur. So we take the foot and we create an arch through that foot. It aligns everything up, so now that stress is going properly through the hips. And we can use this when we squat. We can also use it for a little bit closer stance position, and say maybe if we're deadlifting. So we can encourage that same position, because sometimes even in the deadlift, people will have those feet fall in and the knees collapse, and we're not having that force go through the body properly in order to really pull that weight the way that we want. So we've talked about a couple ways on how to correct the knee position or foot position using the mini band. But now let's talk about how to use the loop band if you have someone or yourself who has a hip shift when they squat. Now typically this is done with a partner, but since I don't have any friends here, what I'll do is hook the band to the squat rack. Now, let's say I'm somebody who shifts to the left when I squat. What that's gonna do is it's gonna put me in a bad position for my back, it's gonna overload one side, it's gonna even create some issues with the spine. So, a simple thing that you can do to help correct this issue is to put a band around the hips. What we want is, so if I shift left, I actually want that band to pull me left. So that way it encourages me to shift right. Now, when I squat with that band, if I allow the band to take me, it's gonna take me to that normal pattern. However, this encourages you to think that this band you want to fight against. So when I go to squat, I'm going to naturally shift a little bit more to the right. Now, why the partner helps is because then the partner can travel with the individual as they go. If you have to use this tactic where you have it against a squat rack, it makes it a little more challenging because the band is anchored to a specific spot, so it doesn't really shift with you as well for that anchor. However, it's still a very good tool and we can use it if we are by ourselves. And lastly, let's talk about split squats. A lot of times in split squats, people will express the same kind of issue as a squat where the knees will fall in, or because we're in a split stance, that one knee will fall in, and perhaps it's because of glute weakness, so they're not able to externally rotate properly as they go through their range of motion to keep that knee in a nice line or just outside the foot. So what we can do is use the loop band, put our leg inside the loop band. So if I'm training my right leg, being the front leg, and I have a tendency to fall inward, I can put that band again on the outside, so it encourages that pulling in, but I'm fighting against that band. So at the end of it, we are encouraging that person to drive the knee outward. So with this position, all I have to do is go up and down, and that band is wanting to pull me in, but since I'm fighting against it to keep that nice line, I'm now getting that tension up in that hip where I really want it. Band wants to be below the knee. You don't want to be above the knee on this one. We want to stay below the knee and fight that band. So it wants to have enough tension to where I can fight it. I don't want so much tension that it pulls me in and I can't fight against it properly, or I'm doing that shaky knee to try to go through my repetitions. So that's how you use the mini band and the loop band as a tool to assist with correcting some of these issues that we may see in ourselves or in our clients. Thanks for watching.